There's a woman on TikTok who has made a multiple part series about how she fell in love with her psychiatrist. There's a lot of discourse online about the whole situation, but I want to talk about her misunderstanding and inaccurate information about the concepts of transference and countertransference. In one of her videos, she defines transference as, quote, when a patient has a crush on a healthcare provider, end quote, and then goes on to say that this is a common thing in mental health. Although transference may involve romantic feelings, this definition is a fundamental misunderstanding of what transference is. Transference is a redirection of feelings from the client onto their provider. It is not a direct relation, as this woman is stating, nor is it solely about romantic feelings. With transference, the client may have feelings or desires about a specific person or situation and direct those feelings to their provider. An example of this would be if a client has a lot of anger towards their mother and their therapist is of similar age or has other qualities that remind the client of their mother, so they project their anger towards their mother onto their therapist. The client is not actually angry at the therapist, but the dynamics in that mother-child relationship show up in therapy. In a separate video, she defines countertransference as, quote, when the provider has inappropriate feelings for their patients, end quote. Once again, this is inaccurate and a misunderstanding of what countertransference is. With countertransference, once again, we have a redirection of feelings. However, this time, the provider is redirecting feelings they have about a person or situation onto their client. An example of this may be the therapist has a client that reminds them of their child, and because of that, they are overprotective, maybe don't set boundaries, maybe don't challenge the client to the extent that they should, because they are taking on more of a parental rather than therapeutic role in that dynamic. So no, transference and countertransference are not about romantic feelings on the part of the client or provider in a direct interpersonal nature. They are about the redirection of specific feelings towards an outside person or situation that show up in that professional relationship.